I'm not a conspiracy theorist, and I'm not attempting to become involved in that, but I believe what I see with my own eyes and ears and have witnessed with dozens of friends and family during the months of this COVID nightmare. I guess I just didn't take the subject seriously enough before, but now that COVID's reached out to hurt our family directly in the loss of our 42-year-old son, and are witnessing firsthand the nightmare that led up to that, I don't want to be silent about it anymore. I believe in the seriousness of COVID virus. I always have since it all started. I'm not here talking about masking or vaccinating for COVID. I believe in both, that if you believe it helps, you should do it. I'm speaking to people, all people, whether you mask, have had the vaccine or not. I'm speaking to you about proactive treatment before you're diagnosed with COVID, and early treatment if you get diagnosed. First of all, realize that within the majority of the established medical field, there is no proactive treatment or early treatment. Unless you are extremely fortunate to have a family physician that's willing to pre-treat, any visit to the doctor to try to prevent COVID will result in advice to mask up or get the vaccination. That's pretty much it. But we all know that many people already have been doing that and still becoming COVID positive, and in many cases very ill. Too often, even in those cases, it can be fatal. Understand that if you're diagnosed COVID positive, odds are that you will be sent home with nothing. You might be advised to take something like Mucinex, you might get an oral antibiotic, but in so many cases you won't get serious attention until you're very, very sick, and then too often only if an ICU bed is available. And you will very likely get medications that can and will cause renal failure. How many COVID deaths have you heard about that ultimately died from kidney failure? Once you enter the medical treatment of the traditional doctors and hospitals under the guidelines of large medical corporations, you will be treated according to a protocol. Protocols. I hate that idea. A protocol is a defined treatment plan hailed to be the most effective treatment, but it also protects the prescriber, physician, hospital, or clinic from liability should things go badly, because they can say they were following protocol. The current COVID protocols for these groups rarely includes any early treatment of the sickness, except for the presented symptoms at that time. Our son went to the hospital emergency room. He was diagnosed COVID positive, x-rayed, diagnosed with COVID pneumonia, and sent home with nothing but advice to take Mucinex. After much insistence, finally a provider gave him a common oral antibiotic and an inhaler. He was repeatedly told their protocol did not allow anything more at that time. COVID can advance in severity very quickly. Garrett's continued to do so. After just a few days, he was so much more sick and exhausted that he was rushed to the nearest hospital, which was a small rural hospital and completely unequipped to handle a situation like that. An open ICU bed in a larger hospital could not be found. It took almost 24 hours to get a pulmonologist to video conference them. He immediately recommended ventilating. At that point, Garrett was still alert and attempting to talk to his wife. They took him in to attempt the ventilator, and within an hour, Garrett was gone. We've heard this same story repeated to us by others' experience, even since this happened to our son. This was a tragedy for our family and for his wife. A tragic tragedy, and one that I believe could have been prevented. I know personal acquaintances, family friends, and friends of friends, numbering in the dozens, who are avoiding COVID sickness and many times preventing it happening or becoming serious or requiring hospitalizations by treating with ivermectin and hydroxychloroquine. Now don't leave me now. Please listen. I witnessed too many for too long to not be vocal and public in my support of it. As a pharmacist, I don't know why they appear to work, but I do know dozens who can attest to this. Obviously, I can't name them for their own privacy. In fact, two more close friends have just experienced this in their illness. They had been diagnosed with COVID and sent home with nothing, and their worsened condition put them in bed. But after hearing a doctor who would prescribe them these medications, they were amazed at their rapid improvement within just 24 hours, and I'm happy to report that both are on their way to a full recovery right now. I have two close friends currently awaiting a video conference call with a doctor for this treatment. What a shame that such a simple treatment offers hope of avoiding hospitalization and even hope of illness together from COVID. If you know me, you know I'm an honest man. I wouldn't be telling you this if I didn't believe it completely. If we could have gotten our son the medications in time, I believe he would still be with us. And I'm talking about getting the medications under a doctor's supervision and prescription. You've all heard of hospitals seeing an increase in ivermectin toxicity. It's happening. And it's happening because people are trying to self-medicate with veterinary forms of ivermectin, using incorrect dosing, and they have no supervision or instruction on proper use. If you want to avoid the accepted protocols, which do not include pre-treatment or preventative treatment for COVID, you need to look into this. There is a dose for prevention before a positive diagnosis and a dose for treatment after a positive diagnosis. It will include an initial high steroid injection dose and recommendation to take zinc and other supplements daily. I know of too many successful situations with this to be quiet any longer. I wish that I had expressed my beliefs about it before. Our son might very well still be alive if I had. Oh, by the way, our son had already had COVID once, and he had recovered completely. He often donated blood, and when he gave blood later, he was told by the blood bank that his blood was loaded with COVID antibodies. So we all need to be proactive, whether we mask, have a vaccination, or have had COVID before. If your physician will not prescribe these medications, contact American Frontline Doctors. You can call them from the number on their website. There's also other online doctors on the web who will see you by video conference. After a video session with you, they will determine if you've been diagnosed COVID positive or live in a determined COVID hotspot. With this knowledge, they will prescribe for you the necessary medications. I'm sure that there's some out there where the medications have not worked for them. I'm a realist about that. But I can tell you of the dozens of cases I know, there has not been one failure I've heard of yet. If this information saves the life of even one person, all this will have been worth it. I'm sure I'm going to be criticized for saying all of this. I'm sure I'm going to get some hate messages. I'm sure some people are going to blow it off. I don't care anymore. If I had said it all sooner, we might still have our son Garrett here with us. And because I'm saying it now, just because, maybe you'll take the action to proactively protect yourself and your loved ones. Thanks for listening.